Hello friends, today I am going to explain about the emergency contraceptive pill. So emergency contraceptive pill is one of the type of family planning methods which is used by the couple during the emergency condition when the couple had an unprotected intercourse. So in family planning, when the couple has wanted to give a gap between the first baby to the second baby or the next baby, or the couple doesn't have plan for the baby, so they can use various types of contraceptive method which can be protected from unwanted pregnancy. But in case if there is if the male doesn't use the methods, like example condom, or female doesn't use the method of female condom, or any contraceptive pill or copper T, in that case, and when there is no natural interrupters, in that case unprotected intercourse happens. So during that case, the women can use the emergency contraceptive pill. But this is not a continuous process. This medicine cannot be taken continuously, but it is only in case of emergency. So emergency contraceptive pill are sometimes called as morning after. Okay, morning after pills or postcoital contraceptive. The another term is morning after pill or postcoital contraceptive. So this work by preventing or delaying the release of egg from the ovaries. That is ovulation, we call as from the ovary. When the egg release, that period is called ovulation. So these pills help in delaying the ovulation. So they do not work if a woman is already pregnant or already fertilized. They do not work. They just work as a preventive method. And when the copper bearing IUD also can be used for emergency contraceptions. Okay, so next, what pill can be used as emergency contraceptive pill? So in the emergency contraceptive pill, there are various hormonal combination pills are available. The first one is a special emergency contraceptive pill product with levonorgestrel only. There are pill which contain only levonorgestrel. So or unipristol acetate. Another composition is unipristol acetate. In short form, it's called UPA. This is the first type of emergency contraceptive pill. Second type is progestin only pills with levonorgestrel or norgestrel. Second type. Third type is combined oral contraceptive with estrogen and progestin. Both the estrogen and progestin hormone is composed in that pill, that is called combined oral contraceptive pill. Levonorgestrel, norgestrel, or nortindrone, also called norethisterone. Okay, norethisterone. So when the mother should take. So it should be taken as soon as possible after the unprotected intercourse. The sooner the emergency contraceptive pill is taken after unprotected intercourse, the better they prevent from pregnancy. As soon as possible, the sooner the mother or the woman takes, it is more safer and it can be protected. So it can help to prevent pregnancy when taken anytime up to 72 hours. It's given till 5 days, but mostly it is effective within 72 hours of unprotected intercourse. How effective this emergency contraceptive pill? Let's see. So if 100 women, if example, if we take 100 women, 100 number of couple, we say 100 number of couple had an intercourse or sex once during the second or third week of the menstrual cycle of that woman. So without using contraception, without using any contraception, then what happens is 8 women will likely to get pregnant. Out of 100, 8 women will likely to get pregnant without using any contraceptive method. Second effectiveness is if all 100 women use unipristol acetate, that is emergency contraceptive pill types, fewer than 1 woman will likely become pregnant. Means this is highly effective. That means very few, either 1 woman might get pregnant out of 100 women. Okay, then the third type is if all 100 women use progestin only emergency contraceptive pill, then 1 woman will likely to become pregnant. This is the chances. Then fourth one, if all 100 women use combined estrogen and progestin emergency contraceptive pill, 2 women will likely become pregnant. So here understood that if a woman doesn't use any emergency contraceptive pill, then out of 100, 8 have a chance, and those who use, then out of 100, 1 or 2 have a chance of getting pregnant, or it can be the failure of the emergency contraceptive pill. So there are some side effects which I would like to say. Side effect, health benefit or health risks of this contraceptive pill. So some users report that changes in bleeding pattern and changes during the menstruation, like slight irregular bleeding for 1 to 2 days after taking emergency contraceptive pill. Okay, slight bleeding might women get after taking emergency contraceptive pill. Monthly bleeding that start earlier or later than expected, means the menstrual cycle, monthly bleeding, the timing might fluctuate, might start little earlier or might be later than the date. If the first several days after taking emergency contraceptive pill, women after taking emergency contraceptive pill for few days or several days, women might experience nausea, some might experience, some might not experience nausea, abdominal pain, fatigue and headache, breast tenderness, might feel dizziness, or can get vomiting also sometimes. So here non-health benefit. What is the health benefit here of emergency contraceptive pill? The only benefit here is protect against what? Risks of pregnancy. So it only protect against risks of pregnancy. Other than that, there is no such health benefit can be applied. Non-health risk. Any health risk is there? There is none. No health risk. So we should work upon it not be taken regularly, but otherwise some side effects, some irregularity in the hormonal cycle and the menstrual cycle might occur. Other than that, no health risk is there. So there are some misunderstandings that common people have. So the emergency contraceptive pill, okay, the misunderstanding is can be used by women of any age, including adolescent. Okay, so correcting this misunderstanding about many questions have arisen. So do not cause abortion. It doesn't cause abortion. It can be used by any age group of reproductive age group, we say, and then do not prevent or affect implantation. It doesn't affect any implantation, or it doesn't prevent from implantation. Okay, and do not cause birth defect if pregnancy occur. In case if the emergency contraceptive pill before taking, women already has fertilized, already got pregnant, and afterward if she have taken that medication or the pill, it doesn't cause any birth defect to the pregnant women, okay, or the birth defect to the baby. Are not dangerous to women's health. It's not that dangerous to the women's health. women using progestin only or unipristol acetate emergency contraceptive pill formulation are much less likely to experience nausea and vomiting than women using estrogen and progestin. So, emergency contraceptive pill, it doesn't increase risky sexual behavior, it do not increase risky sexual behavior, do not make women infertile, women may get pregnant and the next time, then can be used more than once in a women's cycle, but as a precaution, we should try to avoid using emergency contraceptive pill other than that apply the contraceptive methods. Either it can be permanent method, temporary method, so that we can prevent the women to take the emergency contraceptive pill. Example, a male can apply a method or a temporary method of applying condom. If women, then the women can apply temporary method. There are female condom also available, but male condom is more comfortable, and the women also can have a contraceptive pills which are available, Maladi, Mala, and if the woman has already had a previous baby and wanted to do a gapping, then can apply intrauterine device, like example copper T. So there are various methods, and if their family planning has been completed and they don't want any more baby, then they can go for permanent methods of contraception. Like for the male is vasectomy, cutting of vas deferens, and for female also can be done, that is tubectomy, cutting and tying of the fallopian tube. So these are the methods. So for today, I have explained about the emergency contraceptive pill. I hope all of you have benefited with some information. So stay tuned, wait for the next video.